contusion, as the name indicates, it is very superficial, we can easily see. So the deep bruise, name indicates it is very deep, and it is on very deep to the muscle or something like that. But the thing is, it appears delayed. Okay, if you wait for like one or two days, so it will comes out, the blood will comes out. So that's why the name comes out bruise. Okay, come out bruise. Remember, if you want to examine the person again, so in the first day there is no bruise appeared as you examine the person, but the second day if you examine on the areas which is not bruised, which is getting bruised. So that's why it is very, very important medico-legally. And ectopic bruise is very, very important for your AIAPGET is concerned. There is two famous example for ectopic bruise, and I'm going to discuss with picture. For a time being, you just remember the definition. Ectopic bruise is basically impact is on the one region, contusion will appear on the other region. So that is called as a ectopic bruise. The synonym, they will play with the synonyms. Remember, percolated bruise. So it is also called as percolated bruise or migratory bruise. So the contusion is away from the site of impact, and the pattern bruise is basically the weapon use. It shows the depict the weapon. Bruise will depict the weapon which has used. Most common example is Lottie. So this is the famous example for ectopic bruise. So the first, your raccoonei. Raccoonei is basically contusion over the periocular area, most commonly seen in the injury to the frontal lobe or injury to the base of your skull. So one more thing you should remember is that battle sign. This is very, very important. Battle sign is basically ecchymosis in the mastoid region. Okay, ecchymosis in the mastoid region. Battle sign is basically due to fracture of, so this is due to fracture of middle cranial fossa. Remember, middle cranial fossa. So they might ask you the question, the person is coming to the emergency ward with a head injury, and you can see on examination there will be bruise on the mastoid region. What will be the probable fracture of the skull? So the options will be your anterior cranial fossa, middle cranial fossa, posterior cranial fossa. Remember, battle sign is basically due to middle cranial fossa fracture. So raccoonei is basically also called as black eye or the panda eye. Actually, it is wrongly depicting. So the black eye will be most commonly on the unilateral side. If it is bilateral, we have a lot many causes, but usually on the unilateral eye, it is also called as panda eye, raccoonei or the black eye. So remember the synonyms, they will play with synonym. So it is due to injury in the frontal lobe or in the base of the skull, and the battle sign is due to injury on the middle cranial fossa, is basically the ecchymosis on the mastoid region. So some of the examples for